We propose in opening up a pediatric clinic called the WeCare Pediatric Clinic that will be branched under the WeCare Health System. In the WeCare Pediatric Clinic, we will be seeing young females and adolescents up to age 18. Currently, there is no clinical pharmacy presence in this clinic at this time. We found this an area of the WeCare Clinic that could be expanded upon, reach out to a unique demographic population, and absolutely make a difference in patient care for the community. Objectives of our clinic: to provide services tailored towards these specific individuals, the individuals being females under the age of 18. Adolescent females are a specific demographic that requires specialized services for optimum healthcare, and our goal is to provide these services to any patient of this age visiting our clinic. Our proposed clinic will provide service in the following areas: sex education, including counseling on proper use of contraceptives, the consequences of unprotected sex, emergency contraception, details about abstinence pregnancy, counseling including goals for pregnancy regarding a healthy lifestyle, proper nutrition if they do decide to carry on with the pregnancy, and referrals for abortions, and also information will be provided for various forms of STDs and vaginal infections. We'll also be including education about HIV and AIDS and the prevention techniques that are applicable to these individuals. It is our goal to not only provide these services to the children of our regular patients at the WeCare Clinic, but also any adolescent females seeking any of our services under parental or guardian supervision. We hope that by providing these, we would best serve the patients of WeCare as a whole and contribute to the recognition of WeCare as a center of excellence for women's health. There seems to be a lack of knowledge regarding general healthcare, prescription drugs, over-the-counter drugs, sex, management of disease states, and vaccination status in the young adolescent female population. We hope to fill in the gaps of knowledge within this patient population, mainly by education, counseling, treatment, or the management of these disease states and conditions. Our clinic will consist of several staff members. We will have a receptionist at the front desk who will be responsible for answering phone calls, scheduling appointments, and ensuring that patients are seen in a timely manner upon arrival. A pharmacy technician and our staff nurse will be assigned to obtain basic background information, patient name, sex, date of birth, primary concern, purpose for the visit, and medication reconciliation. When a new patient enters our clinic, the clinical pharmacist will see the patient's profile and try to optimize their drug therapy and also their overall health. Clinical pharmacists will provide the therapeutic management, patient counseling, education, and referral processes. The pharmacist's scope of practice in this clinic is strictly therapeutic management, counseling for disease states and conditions, and patient education about overall healthy lifestyle. We believe that working with physicians under a collaborative agreement will provide our patients with the optimum level of healthcare. The scope of our practice would involve a large spectrum of conditions and many different medications, and while we are the drug experts, it would be most beneficial to come to therapeutic decisions in unison with each of the patients' physicians to ensure that the entire clinical picture of each patient is considered. Our clinic will be open 6 a.m. to 5 p.m., Monday through Friday, 10 a.m. to 5 p.m., from Saturday to Sunday. Emergency department, on call, 24 hours, can provide emergency counseling over the phone for current patients in desperate need. This will be done via a pharmacist who will be on call. Patients are to schedule appointments through the front desk contact number. Our contact number is 352-309-9872. Our clinic will have its own set of treatment algorithms that will be used by our physicians and pharmacists on staff for the treatment and management of diseases and conditions such as pregnancy planning, sexually transmitted diseases, contraceptive regimens, yeast infections, proper information about required vaccines and immunizations, depending on the patient, information about a healthy diet in attempts to decrease the incidence of anorexia, bulimia, and malnutrition, which is commonly observed in this patient population. We'll also try to provide pamphlets and educate patients on breast health examinations in attempts to screen for breast cancer. As soon as the patient arrives, a detailed medication reconciliation will be taken by either the pharmacy technician or the nurse, where we acquire a detailed past medical history, current medication use, including RX and OTCs, any current problems that have arisen in the patient's life. Many labs will be taken and monitored for depending on the patient's disease state. Blood work will be done in our clinic to get labs missing in our patient profile. If we have all the labs on our patient profile, we will not charge the patients for labs or blood work. We will not be billing for services provided by the pharmacists, the technicians, or the nurses, since they are already receiving a salary on an hourly basis and they're placed in this location primarily for this purpose, to serve the patients of the WeCare Pediatric Clinic. Lab work, blood work, and referrals leading to patients visiting doctors within our WeCare practice will be billed accordingly by the billing and coding department from the main hospital, who work under the WeCare Health System. Patients will be referred to MDs and specialists within the WeCare system, and prescription and OTC products can be purchased in the main pharmacy as well.